Hi guys, I'm Raj Bardwaj. I'm a doctor at the Sheldon Schumer Urgent Care, family doctor here in town. I'm here to answer some questions about COVID that were submitted last week by all you guys. So by airborne, you probably mean aerosolized, and there's a difference, right, between aerosolized and respiratory sort of droplets. Have you ever stood under one of those little misters at the Calgary Stampede? You know, when you stand under them, they cool you down. Most of the droplets land right under the mister, but some of the droplets get driven away by the air, get blown away. And that's kind of what we're doing with the COVID respiratory droplets as well. Most of them fall within a couple of meters of the person expelling them, but a few of them do get scattered elsewhere. And that's why the 2-meter rule is not hard and fast. The further, the better. So it's still really early in this pandemic overall, and we have some evidence that, yeah, people can catch COVID more than once. But you know, we've had over 40 million cases, confirmed cases of COVID infection. We've only had a handful of people who've had confirmed reinfection. So the question for me isn't, is it possible? Yeah, it's possible. The question is it likely? And what happens when you get it the second time? We also think that people who get immunity from a vaccine are going to have stronger and longer immunity than people who catch COVID in the wild. Guys, cohorts are super confusing, but there are a couple of things to remember. One is a cohort is a group of people who you can interact with, stay within 2 meters without wearing a mask. The more cohorts you belong to, the riskier it is, and you only get to have one core cohort. So that's people you live with, your family, people you socialize with all the time, and the smaller, the better. So the second thing is it's kind of easier to think about a cohort, if you think about the way people have sex. Okay, so most of the time, the safest sex is if you're having sex with only one person. But if your partner is then having sex with 3 other people, now you are potentially exposed to any of the infectious diseases that those 3 people gave to your partner. And if they're each having sex with different people, then it goes on, and the risk builds. You can decrease that risk by using condoms and by sticking to that one partner and make sure your partner sticks to one partner. Same thing for COVID. Wear a mask and stick to one core cohort. All of our tools that we have to control this pandemic are kind of like slices of Swiss cheese. If you want something not to get through some Swiss cheese, you got to use more than one slice. So masks are not perfect. They have some flaws, just like a slice of Swiss cheese. But if we start layering the slices of Swiss cheese up, then you can actually prevent something from getting through. So masks are one layer of protection, but so is distancing, so is washing your hands and not touching your face. The best tool we have, the best slice of Swiss cheese, is distancing and avoiding people. But it's also the most painful, right? If everybody completely isolates for a few weeks, then our numbers will plummet. But could you do that? Could the economy take that? It'll plummet too. So the guidelines around restaurants and masks are confusing, right? But that's because we're not just balancing your individual risk. We're also balancing the risk to the community. If community transmission goes way up, if people get sick, then restaurants might have to close again. And we don't want that to happen. So we balance the risk. We say, look, wear your mask as much as you can, take it off when you need to, like when you're eating. Symptoms are different in different people and even in people of different ages. A lot of kids have minimal symptoms, if any. A lot of adults also have minimal symptoms, but loss of smell and taste is one of the symptoms. The more common symptoms are things like fever, just feeling tired, sore throat, cough, things like that are definitely symptoms. So is loss of smell and loss of taste. This is looking into the crystal ball, and I don't have a crystal ball, but vaccines, could be approved by the end of 2020. But even when they're approved by the drug company, they still have to be approved by Health Canada to make sure they're safe and make sure they're effective. And then we need to actually get the vaccine out in millions of doses across the country. And then you might not be at the front of the line. They might put healthcare workers at the front of the line, or older people at the front of the line, or teachers. So the idea is that you should get tested if you have new ongoing symptoms. So if you've got a runny nose because you were just outside biking or tobogganing or whatever, that's not COVID. That's being cold and coming inside. But if you have even minimal symptoms that last for a whole day, you should get tested, whether that's a runny nose or a sore throat or a fever or just feeling out of it. This is an important one. So even though the majority of people don't get super sick, don't get hospitalized, even if a small percentage, let's say 10% of people get sick enough to be in hospital, that is very quickly going to overwhelm our hospitals with sick people with COVID. And then what happens if you're on a scooter and you fall and you break your wrist? You end up waiting a lot longer in the emergency room because the doctors and nurses are busy treating people with COVID. What if your dad has a heart attack? What if your sister goes into early labor and they have a hard time getting medical care because the hospitals are full of people with COVID? That's the risk. That's why we're taking this so seriously, because everybody is susceptible to COVID and a small percentage of people get really sick from it. Yeah, there's a theoretical risk that if you're wearing your mask, if you're reusing your mask, if you're sharing masks, if you're touching the outside of your mask and then touching your face, that you could actually spread infection from the mask to yourself or to somebody else. That is a theoretical risk. We're just not seeing it. What we're seeing is super spreading events in places where people aren't wearing masks. So stage 3, I don't think it's going to be a thing for a while, but that's not my decision, luckily. That's the provincial government's decision. And the provincial government has not published anything about what kind of criteria they're going to use. Certainly the amount of community spread is going to be a criteria, I think, and where the spread is coming from, how good we are at being able to trace the contacts. Right now, about 40% of people who get infected with COVID don't know where they got it from, can't trace it. And until that number gets lower, stage 3 isn't going to happen. Let's get this straight. There are no supplements, no vitamins that have been proven to boost your immune system. So vitamin D, yeah, we should all be taking a small dose of vitamin D because it's winter in Canada. But will it boost your immune system? Will it make you less likely to get COVID? We don't know that. We don't think so. Vaccines boost your immune system. If you're worried about boosting your immune system, get a flu shot. That'll boost your immune system versus the flu, not necessarily against COVID. COVID is hard, but it's worth doing all the right things. We're doing it for our kids, we're doing it for our parents, we're doing it for our teachers, we're doing it for our friends. The science is making progress. We're gonna get through this. But in the meantime, we have to be conscientious, we have to be safe, we have to be kind. We got this.